with introductions, and I'm just going to start from the top of the list. I don't think Alyssa is here yet, is she?
No, I don't think so. Not quite yet. She might.
Okay.
She might be a couple minutes late.
Okay, her name is showing up, but
oh, that's Bobby. I logged in on her Zoom account, so I'm Alyssa.
Okay. Well, will you introduce yourself, Dawn?
Sure. Hi, I'm Dawn Woods, and I'm the director for the Office of Child Care of the Early Learning Division.
Great. And Michelle?
I'm Michelle Gurry. I am a child care provider in Southern Oregon.
Thank you. Welcome. Tim?
Tim Rusk, Executive Director of Mountain Star Family Relief Nursery in Central Oregon.
Great. Welcome. Abby?
Hi, Abby Bush with the Oregon Community Foundation.
Welcome. And Kamala? Oh, we can see you speaking, but you're on mute. Right, let me see.
Okay,
Yeah,
sorry about that. I'm Kamala Wymore. I'm an account manager with learning.com.
Welcome. And let's see, Sue Norton.
Hi, I'm Sue Norton. I'm the manager for the Child and Family Education Department at Lane Community College.
Welcome. And Pam? She just joined, so maybe she's not on audio yet.
Bobby, I should probably readdress what I do too. I have shifted from doing childcare out of my home to doing very part-time childcare, and I'm more doing parent education now.
Oh, a combination.
Yes.
But primarily parent education?
Yes.
Interesting. Thank you. Okay. So I think as soon as Pam is on audio, that is all the committee members. But we've got Chris. Can you introduce yourself?
Hi everyone, this is Chris Plattner. I'm the executive support for the Office of Child Care and the support for this meeting and committee.
Thank you. And are there any other staff who've joined us? Okay. Then we have some members of the public. Saya, can you introduce yourself?
Yeah, I'm Taya Harvey. I'm actually the director for the CCR&R in Lane County.
Oh, welcome. Great. And Susan?
Hi, I'm Susan Zundel from Oregon After School for Kids.
Great. Welcome. And now we have 3 phone numbers. And without names. So maybe I'll just ask, is there anybody else who has joined the call whose name we haven't called?
I'm Autumn David from Family Child Care Provider and Acting President.
Oh, welcome. Sure. Is there anyone else? Okay. All right. Well, welcome everybody, and we have a full meeting. We're going to start. This is just a review before I turn this over to Dawn for the parent survey results. But this committee had been very interested in getting parent input into the process for revising the child care rules. And the staff developed a survey that then a couple of us, Pam, I know, and others, who reviewed it and gave the staff feedback on and actually it went through several iterations and ended up with, I think, a very effective survey. And then staff distributed the survey widely, and then the committee weighed in, and we shared the link to the survey and got some ideas from the public and others about, like, I remember the PTA, and anyway, we also participated, and it was a great success. And we're going to go through the findings. And our role today, as you listen, will you keep in your mind, what are the implications? If parents think that, what would that tell us about early learning decisions, about policy that's set on early learning? So I'm going to turn it over to Dawn.
Hi everybody, Dawn here, and let me just pull up the survey. I know that it went out. I thought I had it queued up. Oh, it's a PDF, which is why I can't find it. Okay, do you see it? I apologize. I really did think I already had it queued up. Chris is going to help me. But so while she's pulling it up, I'll kind of give an overview a little more. No, not down there. Okay. So we sent this survey out, as Bobby said, with a whole bunch of different responses, and we actually had 668 parents respond to this survey, which I think is quite remarkable, that was the information, that was the response rate. So I want to thank everybody who helped to get that information out there. And we use this, as you guys know, to help inform the child care rules, but given the high response rate, thought it was, important information that we can use kind of as we carry on in our work in early learning. And thank you, Chris, for getting this up for me. So we thought it would be helpful to just kind of go through each of the 7 questions and provide an opportunity for comments that the committee members might have, any reflections when you reviewed the survey. So this first question is looking at kind of around, I think the Office of Child Care's regulations for child care programs are appropriate. So it's kind of on a Likert scale. I think some of the Office of Child Care regulations for child care programs are too harsh. The one that got the most responses, 356, was I would like to be able to check on my child's child care provider's compliance and inspection reports whenever I want. And then the other highest one was I would like to better understand and be more involved with regulations that my child care provider must comply with. And so a lot of that, I guess my interpretation is that, parents do want to know and understand maybe the compliance a little bit better and have, that information at hand, but I'd be very interested at kind of what other people think about these results to that question.
Hi, this is Pam.
Okay.
I thought it was really interesting that so many, it makes sense to me that so many folks want to be able to check into the compliance history and inspection. But I just thought it was interesting that it was so tilted in that direction. And I immediately jumped to, okay, that's cool. How can we provide that?
This is Dawn, and I think I could take this opportunity is that we have updated and significantly enhanced our current online. It used to be a complaint website, valid complaints, and now it is broadened to really a fuller compliance history of programs. And in order to stay in line with federal regulations, as well as I think what we've seen in this survey, we'll also have summaries of their inspection reports as we move forward implementing the new federal law. So the current child care safety portal has a lot more information than we've had in the past. And there'll be more information added kind of as we continue to move forward, make enhancements, and continue to comply with the CCDF reauthorization of 2014.
So Dawn, they announced at this morning's meeting that it was up and running, but I went in and could not get anything to come up. Is it still in development?
No, it's out there, so it should. We can check that. I
tried to name 3 different child care facilities, and for all of them, it said no record.
Okay, well.
I mean, I'm not the most computer savvy person, but it seemed like I should be able to put in the information and get a record. And I thought if I were a parent, I'd be pretty frustrated.
Absolutely. We will look into it. I think Alyssa, just so people know, Alyssa just walked in, and I believe she's pulling it up right now and checking it.
Oh, great. Yeah, okay.
Okay. And I would say that's part of the reason we haven't like pushed out big communications, is that we're working on making sure that everything is working, but you kind of have to have it live and pulling in the data for us to continue to do ongoing testing. So Alyssa said it worked for her right now, so maybe there was just something down.
Okay.
But if anybody has any problems, there's actually on the front page where you get to the portal, there's a link that you can send us that here's like if there's inaccurate information or if you're having any problem, and that gets flagged instantly to our IT people so that they can go and troubleshoot quickly.
There's a feedback button, so that'll come directly to our team.
So I just, for committee members, I just Googled, or I think I just Googled Oregon ELIS, ELIS, and it came up. No?
Oh, I'm surprised that it came up with that.
I did something that was pretty generic, and I got the Oregon Early Learning Division page, and then it said safety portal. Is that?
That's it.
That's it. I wonder if it was so I would recommend that people either go directly to our website, the Early Learning Division website, or if you Google Child Care Safety Portal, that should get you right to it.
Yeah.
So the next question, if there's no other kind of comments on that, was asking to please rank the statements below according to what is the most important to you when considering your child care program. Give one of the most important and a 4 to the least important. So the most important that they identified was those who operate the program will keep my child healthy and safe. And that at 73% it's definitely the top desire of what their expectation is.
Okay, so tell me again, a high score was more important or least important?
Give a 1 is the most important and 4 is the least important. So the most important thing was those who operate will keep my child healthy and safe.
Okay.
And the least important was persons who work with my child are qualified to work with children through their education.
Okay, and then what about through their training? Do we read it by reading the score, 3.53 being the highest, the next one being 2.60? Is that? I didn't know how to read it. When I read it last night, it was like, oh, I'm not sure how to read this.
So here, let me read them in order of how I think it is anyway. So, you know, that the most important that was identified was, you know, the program will keep my child healthy and safe.
Okay.
The next one is that activities support my child's ability to learn and to develop physically and emotionally. Then the bottom one, persons who work with my children are qualified to work with children through their training. Right. And then oh, whoops, I read the wrong one. I apologize. Oh, that sounds like we had educate. It went to training, and then to education was the last one.
Okay.
So
Okay.
their safety and their development were the top two, and kind of the training and education were the least important in terms of identifying
their priorities.
Yeah. And then kind of maybe I should move through these and then have people kind of give comments as they want, but we'll kind of look at it totality. Of the statements below, choose the two that best describe what you care about the most. And so I think pretty clearly the person who works with my child is attentive to my child's needs. The next one is that the child care space is clean and sanitary. I feel comfortable approaching the person who works with my child. There's a variety of activities, and that the room is welcoming and the temperature is comfortable was the least. The fourth question of asking them to choose two that would assure you that most of your children, that your child is in a healthy and safe child care environment. The responses were really predominantly that there's enough people present to meet the needs of all the children, and that the child care environment does not have any hazards that are accessible to children. And then the other three are fairly in kind of that same range of that there's space, those who work ensure that there's healthy meals and snacks, and that there's acceptable guidance and discipline policies. Question 5 is choose the two that best match your thinking about a child care program safety record. And again, it's the program works to exceed the Office of Child Care's requirements was the most important identified, followed by really closely that the program has no compliance violations I consider serious, or the program has no compliance violations, like I think at all. And then kind of ending on that the program that has some compliance violations, but I trust the people who work with my child, and I don't think that compliance violations will affect what happens to my child, and that was about 7% who felt that. Question 6, this is the second to the last one, is that, choose the two that are most important when thinking about the qualifications of the person who works with my child. And the top one was that the person who works with my child is educated about early childhood development and working with children. The number 2 response is that the person who works with my child has many years of experience working with children. And then the third was really that the person who works with my child has college or professional credentials in early childhood. And then a very few responded that the person who works with my child doesn't need much experience or education. And then the final question that was asked in the survey were the 2 most important things when thinking about training and experience of the people you work with. And this was that the person who works with my child has training in a broad range of topics. And really closely behind that, I would consider these the top 2, that the person who works with my child is continually taking training and continuing to learn. And followed by 3, that the person who works with my child has training in child development. And then ending with that the person doesn't need any special or ongoing training as long as they're caring and competent. So those were the survey results that we received. And so it'd be, I don't know, Bobby, any reflections?
Yeah, I'd like to hear thoughts. The one that hits me is if you put education and training up against health and safety, it doesn't rank as highly. But if you put it like for questions 6 and 7, education and training are getting above 75% or around, well, no, great 60 in the 60s or 70s. Anyway, I think that was of interest to me. I'd like to hear what other people heard.
So this is Michelle. One of the things that I question is how are we specifically looking for parents that have kids in the 0 to 5 birth range with this survey?
We didn't restrict it, did we, Dawn?
No, we didn't. It was sent pretty widespread, so it would have gone out to a variety of ages.
Okay, so that was one of the first things that I thought of. The second thing that I thought of is the fact that, let me see, I got to get back to where, can you scroll up a little bit?
What was the topic?
I think it was question number 6.
That's education and experience.
Yeah, so I'm curious if we're primarily promoting the survey to parents that are working with agencies versus childcare providers, then the requirements of those agencies are going to be a little bit higher, in my opinion. Like Head Start, any of the family nurturing centers, the relief nurseries. So if a majority of the parents that took the survey are doing so based on their interactions with childcare centers, relief nurseries, or Head Starts, or similar programs where the requirements might be a little bit higher, then that would explain why the number of people who are working with my child are educated about early child development. Does that make sense?
We didn't ask demographics of the respondents, did we? I can't imagine that we got parents from only one type of care, Michelle, because this is 644 and we all encouraged parents to participate. So I can't imagine, but we can't answer your question because we didn't collect demographics on the respondents.
I'm just thinking that the numbers might be skewed based on those demographics and what agencies or what facilities parents might have those interactions with, because I don't necessarily know that a parent just going to a family child care provider would have known about this survey.
Well, we could recap, but it was sent out like to all the PTAs. It was sent out, a number of us, I'm trying to think of the list that we sent to the link to.
Bobby, this is Dawn, and I mean, I'm pretty sure that we also sent it to the union, which would, I don't know if they sent it to their providers for their parents, if that got out that way too, and that would be the child care providers, the small business ones.
Okay. Is it Autumn that's listening right now? Because I think she said she was a union rep.
Autumn, do you remember getting a link to the survey to share with your members?
I don't remember to share with my members. I remember seeing it in my email, but I don't remember being asked to share it.
Oh, you saw it,
I totally agree with what she's saying about the audience that was.
I think though, if you go up, Dawn, I think it was one of the early ones, like maybe 2, the question 2. What you see, I think is that makes me think they really did mean that one was. Is it? Yeah, here it is. Okay, and it was where health and safety came up so much higher. Yeah, but here, and then qualified through education and training are relatively low. It depends what the choice points are. whether we got it. So I mean, this is a literature I follow closely, the reading different work done on how what parents say is important about childcare, and this is pretty darn close. So I mean, we can't answer the question, Michelle. If we were doing a scientific survey, we would have pulled a random sample, a stratified random sample of parents of different, who are using different types of care or whatever, racial, ethnic groups, whatever. But this was a survey that was just broadly shared.
Right.
And so we really can't answer. But I think I would just say my own opinion is if you look at the answers to the second question, it puts the ones you're concerned about into context.
So here's the reason why I bring this up, because when we're working with parents that are in crisis mode or having difficult situations come up and they're having to deal with childcare, they're not always going to make the best decisions as far as who they place their child with, because they just need, let's say you have a parent who is needing to find a job or housing or whatever to just get their feet under them. I think that needs to be taken into consideration when we're looking at this survey, because I don't know that the broadness is there in the results of the survey. I appreciate the fact that we had so many people respond to the survey, but I'm just thinking that it might be a little bit skewed based on the housing situation and the parents that were actually contacted to provide the results of the survey. So I just want to put that out there.
Yeah, we cannot say that this can be generalized to all parents in Oregon or
Right.
all parents of a certain age, because it wasn't the way the survey was done.
Okay.
Are there, it was done to give us insight into what parents who were willing to, it's called a sample of convenience, and what those parents who voluntarily completed the survey thought was important.
Understood.
Any last comments before we move on?
This is Tim. I guess just based on the last conversation, it has me wonder, like, what would the response be if we asked a question like, sometimes I make childcare decisions, less than optimal childcare decisions, because of resources or because of timeliness. So we kind of drilled a little bit more into the point of decision making when a parent under distress may choose something that they know is not the best circumstance for their child, but feel compelled to do that for some outside reasons.
What the research literature shows is that if you ask parents who are in a current arrangement about how satisfied they are or how good they think the care is, you're going to get very positive ratings. If you ask them about the last provider they had, you don't. So, and that is consistent. That's not one study. But I think it addresses what you're talking about. But some people say, oh, that means that parents are just in, they have cognitive dissonance. How's that? But anyway, that parents won't deal with the reality. It could be that the reason they don't speak highly of the past provider is the reason they left that provider. But there is the same thing in public schools, by the way. Even when an outside rating gives a school an elementary school a low rating, the parents will give it a very high rating. Or when the Office of Child Care has to close a child care program because of horrendous danger to children, the parents who are in that program are going to defend the provider. So,
interesting.
so what you're getting at, I think, and is helpful, is it's a complex experience.
But hands down, you know, what we see here is people concerned about the safety of their child. That's the number one concern, hands down.
Every study just about I've ever seen it has said the same thing, that it ranks very highly. And anybody who likes to know, I mean, I've got lots of bibliographies of this in this field, and just published an article on how low-income parents make their child care decisions. So these findings are pretty darn consistent.
This is Kamala, and I have to agree that the survey is pretty spot on. I'm working in early childhood for over 20 years and surveying parents from all kinds of demographics. The child safety is almost always number one. I mean, it doesn't seem to be off at all compared to anything I've seen. So I think it did a pretty good job.
Yeah, and when you put education and training in there with health and safety, it's not as high.
Yeah, and me being a mom, I care about my child's safety first over anything. So.
Right. Yeah. Okay, so I think, thank you, Dawn. And I'm serious, if this is of interest to people, I'd be happy to share other resources, because it's a passion of mine to understand why parents make the child care decisions they do. So I think, Alyssa, have you joined us?
Yep, I'm here, Bobby.
Great. So can you give us just a brief update on the Early Learning Council strategic planning?
Yep, absolutely. So I was going to do a quick run through again of who was able to come to the council meeting last month. So the council was able to hear from DHS for family supports, and then child care and other early learning providers for their early care and education engagement session. That first day, I think, and Bobby, obviously you can speak to this more, was really enlightening just in terms of all the different programs that DHS operates, and it was great to hear from the child welfare director, as well as Kim Fredlin, the director of self-sufficiency. We were able to hear from a parent who actually received subsidy, and her mom, who's the one that provides care to her kids, as well as several family support and connections advocates. That's a program run through DHS, as well as the relief nursery and ERDC provider who was with the parent. We heard from the hubs, as well as some advocates in the field. So we had someone from Family Forward, the Oregon Family Support Network, the Immigrant and Refugee Community Organization, and Cairo, which deals specifically with African immigrants, particularly in the Portland community. So that was a really rich day. The governor also joined the council that afternoon to, and Bobby, please feel free to speak to this, get sort of thoughts and ideas from the council as she really starts to figure out what her budget strategies will be, and as she begins to craft that budget and what her vision sort of is for the system. The next day, I think, was really exciting because you were able to pull together a provider panel of a variety of early learning providers. So we had, I think in total, 4 different child care providers. One was a center director, and then we had 3 different in-home child care providers, as well as a Head Start provider and a Healthy Families Oregon home visitor. And I think the council probably would have liked to just listen to them the whole day. It was really an exciting and enlightening conversation. They also were able to hear from Candy Sanchez, who's a home-based provider in Medford who's benefited from the Focused Child Care Networks, and just seeing the visual representation of her program before Focused Child Care Networks and after, I think was really striking for everyone. And then we ended that day hearing from Children's Institute, Children First for Oregon, Latino Network, and FACT Oregon. And then as we gear up for April, we're actually breaking into a couple more panels to try and get as many voices at the table as possible. So ODE will be kicking off the day, and then we'll hear from Hubs. We're working on getting a parent panel representing early childhood special education, as well as a parent who's had their child in a KPI or kindergarten transition program, an ELL parent, as well as a parent from the Coquille area who will be joining virtually. We're also convening an administrator panel to hear from Tim Sweeney and the program that they were able to develop in Coquille, as well as Lori Hale, who's a principal at the Pendleton Early Learning Center, and then Michael Bacon, who is the dual language director for Portland Public and has some really interesting thoughts on reaching down into early learning with that work, as well as Lauren Sigmund, an early learning coordinator with one of the hubs. We'll have an educator and practitioners panel. We're working on bringing in a kindergarten teacher who works alongside a Preschool Promise program, a P3 coordinator, as well as an early childhood special ed provider. And then we'll also have a providers and community partners panel, bringing in a KPI provider, Dr. Catherine Pierce, to talk about the KISS program in Lane County, a Salem Kaiser Coalition for Equality provider speaking about their parenting engagement program, and a provider from Adelante Mujeres to talk about their Abriendo Puertas program and the family outreach they do. And then we'll end with speaking with some of the advocates, so COSA, the Confederation of Oregon School Administrators. We'll hear from Dan Gaffney about some of their like Pay for Success studies that he's done, and then Matt Morton, who is the Equitable Education Director for Meyer Memorial Trust. So some packed days. I think probably in the next week, we will have some actual feedback that's been collected, ready to share with all committees. So I know we weren't able to get it ready quite in time for this meeting. And I know you guys won't meet until early May, but our plan is to send sort of the summary of the themes as well as all the points that council members contributed based on what they've heard. And so as committee members look through that, if there's gaps that you're noticing or questions you have, or if you feel like there's maybe a community or group that we have not engaged with whose perspective is maybe not being represented, let Bobby know or myself know as we create these additional engagements. But yeah, it's really busy, but it's going well. I think once we get through April's council meeting, we'll have something that maybe looks more like it could be a strategic plan. Right now, it's just a lot of thoughts and ideas. So still in the early stages, but I'll be sharing that information with you once it's ready, hopefully next week.
Thank you.
I know it's a really quick update. Yeah, if you have any questions, let me know.
So the council is in this process of listening and identifying issues and themes, and then by this fall, all of this is going to get put into a form for a strategic plan for an integrated early learning system. So the reason we're hearing from all the sectors is that the governor's charge is for the council to come up with the strategic plan for how the sectors work together. So it's not, you know, we think of the early learning division as focused on young children and their parents and the providers who serve them. Certainly that is a big part of the strategic plan, but we're looking at it through DHS, you know, human services, through K-12, we're going to do health. So I don't know, I think that's an important, it's probably a little different than what people think of first when they think of the Early Learning Council developing a strategic plan, but that goes back to when the council was created it wasn't to focus just on early learning, but to bring sectors together so that what Oregon did was coordinated and had a bigger impact, that we were more effective at really providing the kind of help that would make a difference for people. So I don't know if that's clear.
I think that the work's being done is definitely a move in the right direction. One of the things that I think would be interesting to find out if there's any communities really looking at how to incorporate an early learning facility within, let's say, a new housing development going in. Let's say low-income apartments somewhere. I think that there's a lot of people that would shy away from that, but there's some research studies out there that really show that there's a connection, let's say early learning facilities working within retirement homes, or you know, really center them around the community so that there's more access and more engagement from a parenting standpoint.
Mm-hmm. Yes. That hasn't come out yet, but in what we've heard.
Yeah, this is Dawn, and just to share with everybody, in June is actually we are bringing housing to the strategic planning, and I know that there is work going on between us and DHS with housing. There's kind of a white paper that's been developed about exactly what that is. I think that'll be great to maybe bring forward to hear at the council. Just what you were saying, Michelle.
Yep.
Awesome.
And this is Pam. I was just looking on the website for Home Forward. I thought that they had a collaboration at one of their sites for a child care facility there. And maybe I heard some of the conversations a few years ago, but I'm not sure how it played out.
In one of in what kind of a site, Pam?
I thought it was at New Columbia, an affordable housing community. I think that was their intention. But I don't know if it actually transpired.
Hi, this is Abby. I don't think there is one at New Columbia, but there is a Head Start co-located at the Stevens Creek crossing in Southwest Portland.
Okay,
so
yeah.
They are starting to appear.
Right. So we should be, well, if it doesn't come up before, we'll make sure it comes up now. We'll take your feedback. But also, it'll probably come up with housing, as Dawn said. But I'm making a note to, you know, it's kind of like there'll be a lot of energy. The community development corporations for a while were working really hard to get childcare built into housing developments. And then kind of the energy, I guess, leadership changes. So we need to think of things that take these good ideas and make them more systemic. So, yeah. So thank you.
And I think one of the things that the feedback that I've gotten from just posing that idea down here is there's a lot of liability issues, which you're going to have liability issues wherever you go. But if you build something within a low-income development, you're going to have more buy-in, and it's going to be more accessible to the people that are needing to use it. I also think that, for instance, down here, having the buy-in from specific agencies, like down here we have the Southern Oregon VA Center, VA Source, and having a child care on site for employees would be super beneficial, or some of the larger agencies or companies that work around the communities.
Great. Well, I think this is a good segue into our next topic, and that several of you expressed willingness to work with the Early Learning Council to create parent listening groups around the state. And so let's see, Tim was one, and Sabrina. I'd have to look at my notes. I should have done that before we started. Chris, maybe you can look at our notes, but, well, because my memory's not doing it. But, so we want to take the next step and have Alyssa tell us kind of what the thinking is now from the council administration side. And what I hope to get out of the conversation is if people are going to go ahead and do this, oh, I know, it was Donna, and Donna's missing. So the volunteers were Donna in Harney, and Tim in Central Oregon, and Sabrina over in Ontario, now here. So so what we want to know is if Tim, I guess you're the only one who's on. Have you given thought about what you would need to be able to do this? And Alyssa, kind of what your thinking is, and we hoped as a group to maybe take this to the next step.
I know for me personally, I was really inspired by a presentation at our early learning hub. And that was sort of the driving force behind some of my comments. I think Letitia made it to the event with the Early Learning Council. She was the person that went with Brenda Comiti from Deschutes County in Central Oregon. So it sort of robbed me of my easy idea, and it was already off and running. So the easy pathway on that was already kind of exploited. I guess kind of the second thought is, to try and do something through the Relief Nursery Network as another possibility. So with 30 programs, it seems like we should be able to find a couple places where we could pull something like this off.
To do it, what comes to your mind? What kind of support would a Relief Nursery director need to be able to convene a group of parents, like a focus group, to give feedback to the council?
I mean, my guess, either with that Relief Nursery population or another population, it just takes real clarity about what the questions are. So to really, in my mind, it's a little fuzzy, but to really crystallize, this is going to be an hour-and-a-half process. We recommend food and childcare, to really crystallize the project idea. And then I think that technology is not something that you can help with. The technology really needs to be handled by whoever pulls this together, but possibly some technical assistance support. So if we need to hire a facilitator, that's not a barrier to doing it. Is that helpful?
Yes.
Great.
And I don't know I didn't hear from Donna, so I don't know why she's not able to be on, but there is a parent advisory committee coming up at the Head Start conference. And so that one, what would be needed is this clarity of questions, clarity on the process, and in terms of how long, and some of the things that you mentioned.
Yeah, and I've actually been working with Donna. She has us down in May. I'm flipping through my notes, but I'm working with her to make sure they have what they need as we kind of tee that up. I'm working with our build consultant on Monday to kind of flesh that out a bit further, but we are officially on the agenda for that May Head Start conference. So that's happening.
That's great.
I'm just going to put it out there. I'm going to be at that Head Start conference as well as a presenter. So if you guys need any help with that, please let me know. I'm also thinking that we might be able to do something down in Southern Oregon as far as a parent committee, just to get feedback as well. Is that what you guys are hoping for through these parent advisory councils?
Yeah, I think, we're trying to utilize anything that's in place that we can tap into, as well as create additional opportunities for engagement.
Okay.
The hope is to get as much parent voice into the strategic planning process as possible. Michelle?
Okay.
So like if you know of a group of parents that's already meets, it has a meeting date, and part of their meeting could be devoted to a facilitated conversation on these questions that are that would need to be clearly defined. But that's the kind. So does something like that come to your mind?
Yeah, yes, as a matter of fact, it does. Well, I actually have to run right now, but can we connect maybe tomorrow, Bobby, in the morning?
Yes, but although Alyssa's more the appropriate person than me, although Alyssa, are you available tomorrow morning?
Yeah, Michelle, I'll send you an email and you can find a time.
Okay. That would be great. Thank you.
Thank you, Michelle.
All right.
Okay, and so Sabrina, I will follow up with Sabrina and see if there is going to be an existing parent meeting that she could add us to, or what her thinking is now. So I'll ask her. So Alyssa, do you see your like Carrie and yourself coming up with questions, or how to kind of the kinds of things Tim was talking about, being very clear?
I mean, I'm meeting with Carrie on Monday. I think we have like a 2-hour session to focus on this, but that was what we were thinking, is to be able to provide the questions, given at least an estimate of how much time to budget for. We would, when necessary, cover the costs of food and on-site childcare if that was needed. But yeah, we want to really be able to package this, and if we can't be there to help administer it, just be able to easily hand off what the program or organization needs to be able to conduct these parent engagements. Ideally, we want a council member there so that staff don't have to relay what was heard. We can have a council member share what they heard whenever possible. I think as much as possible too, we'll try to have staff who are there in person, at least remotely, but in person as much as possible, to offer some of that on-site support and answer, questions that may come up. But we want to make it as easy as possible. And I think what we're hoping for is that programs and hubs can do the convening, secure the space, and, run the tech, but that we can give them everything else. We can give them all the questions they need to ask, and sort of highlighting the goal of the conversation. That's what we're hoping to tee up for everyone.
Great. Okay. Is there anybody else on the committee who is thinking of a parent, an existing parent group that that you work with whom a conversation could be this kind of a conversation could become part of that event? Okay. Well, this is great. I'll follow up. So Tim, do you want to ask in your Relief Nursery network if this is a fits for somebody, and get us a name of somebody?
Yeah, I think it'd be really helpful to know the questions.
Before, okay, well, it sounds like that's happening next week. So we'll get the questions first, and then we'll loop in with you.
Because I think, given the questions, it could be more compelling. It might drive some interest to participating.
Okay, great. Okay, and I'll follow up with Sabrina, and Alyssa's already working with Donna, and she will also connect with Michelle.
Yep.
Well, that's wonderful. That's a lot of parent input if we can get even some of this. So, That's very, yeah, it's hard. That's the parent voice is the one that is often missing from a process like this. So thank you to each of you that it's exciting to thought of ways to get a meaningful parent voice. Okay. Alyssa, any closing comments on strategic planning and how the committee can help on it, be involved?
I think my plan is to be able to share some of these high-level themes and the notes that were captured next week. And I'll kind of give a little bit more direction in terms of what we're hoping the committee can kind of skim for. But broadly, I think it's just trying to hold us accountable, recognizing we can't bring everybody to the council table. But if you notice that there are groups that are not engaging, or if there's themes that you think should be present in the strategic plan that aren't represented yet, calling those out to me so we can make sure we're building these agendas to be reflective of what the full early learning system needs and all the players in that system. So I think once we get that first document out to all of you to review, I think this committee and all the council committees will have a much bigger opportunity to really start digging into the strategic planning process. And my guess is at the next committee meeting, we'll probably spend a good chunk of time kind of walking through that and getting people's reflections.
Great. So one of the things that came out from the first listening sessions that the council did, a group that is often overlooked is parents with children with disabilities, whether they're behavioral or learning or any kind of disability. And so if anybody on the committee knows of a group of parents with children who experience these kinds of challenges, that would be a really important group to for the council to hear from directly. It was good. There were 2 advocacy groups who spoke about their challenges, but it'd be great to hear from parents themselves.
Thanks, Bobby. Yeah, we have an ask to get a parent either from CCEC or with children that receive ECSE services on our parent panel this month. And then I'm reaching back out to FACT Oregon, who presented last month, to see if there's anything they already have scheduled that we could tap into, or if they'd be interested in helping us convene. Yeah, so thank you. And if anybody else has ideas of organizations to work with or opportunities you hear of, please let me or Bobby know.
Okay, great. Okay, so this is going to be going on through the summer, the schedule. So this will be a part of every one of our meetings. It will be the strategic planning. And so I think we're ready now to move to the CCDF state plan. And Dawn's going to lead this conversation. And we're going to start with what the heck is a CCDF plan and what difference does it make? So. It stands for Child Care and Development Fund Plan. Yeah.
Yes, and I'm just figuring out how to do this. Here again, I need technical assistance.
As background, I'll just give that that this committee has been asked by the council to work more in depth with Dawn on the plan. And then, I don't know, recommendations might be too strong a word, but for us to give the council input on the, because the council has to adopt this plan, as I understand it, right? And so we're going to be the ones to, was that only that Pam wanted us to adopt it, or do we have to? Which is it?
It's not it's a requirement that we engage with the council and other committees. It's not a requirement that they adopt it. So we're actually working with Miriam to see how we know we want to engage, but does there need to be a formal adoption?
Okay.
We're not sure yet.
But for
we know we don't need one, but if Miriam wants one, then we may ask to go forward.
Then we may
on that.
Okay. So, but we do know already we've been asked to delve into the plan with Dawn's help and to share our thoughts. And so while Dawn is presenting, capture your own thoughts about any questions or things you want more information or that you have an opinion on. And these will all go to the council. So, okay.
Great, thanks, Bobby. Sorry, I'm not more versed on the virtual tools. Luckily, I have a good team here to help me. So this is, I want to kind of walk you through what the plan is and what it isn't, but I've also kind of identified some policy discussions for us to have throughout. And, I think what CCD, what is CCDF? I think it's an acronym that gets thrown around a lot, as it is a large funding stream that comes into our state. And what the majority of the funds are is to really provide financial assistance to low-income working families to help pay for child care, which in Oregon is our ERDC, or employment-related daycare subsidy program. And 70% of all of the funds that come in, 70% of these funds, we transfer over to DHS for the subsidy program. The funding is also to be used for improving the quality and safety of childcare. It's used to support increasing the supply and availability of childcare for all families. And that we've talked a lot in this committee about the reauthorization of the Child Care Development Block Grant Act in 2014, which has, required additional monitoring, additional training for states for getting these dollars. So what the 2014 reauthorization did was, it was a pretty big deal, as it hadn't been reauthorized since 1996, and it created significant revisions. And I think the best way to think about it is that there's an equal emphasis on supporting employment and child development. And that's, of course, cared about safety and child development, but the main goal of that was supporting low-income working families. I think a lot of that has to be said is that the child care division at the time was housed actually in the employment department. And so as we've grown as a field, I think having us sit in the early learning division allows us to really provide that child development and that quality sense. Some of the advancements that happened with the reauthorization, and I'll move through this fairly quickly because I think many of us have heard this before, but that it really did define health and safety requirements for child care providers. There was the new training requirements, new unannounced. For Oregon, as we have a lot of our subsidy dollars going to license exempt, was the addition of on-site monitoring in order to receive the subsidy, as well as 12-month eligibility for families to qualify. And another large part of the advancement was ensuring that parents and the public have transparent information about child care choices, the posting of monitoring visits, and that some of what we talked about at the first part of this meeting as part of the child care safety portal, and having increased information out there to help families make their child care decisions. So what is the state plan? And you can see on the sidebar of the purple that I think it's also important to know what it's not. The word plan, I think people think that it's like a plan for the future, but what it really does is it maps the state's response to the federal requirements. It's actually what we are going to be getting monitored on. So what is in the state plan has to be what is now, current policy practice. It essentially serves as our application for our funds, and it really provides that description and assurance about what the state's doing on the services around eligible families. What it's not, and that's where I think the word plan is a little leading, is that it's not a visionary document. It's not a visionary plan about where we want to go. It's actually a response to what is right now in Oregon. However, anytime that we make a change, whether it's through work of the CCEC that goes up to the Early Learning Council, we amend that so that it's reflective. So our state plan is always current to what the actual policies are.
So, Dawn, can I add, I think this is really important. The Child Care and Development Fund is a block grant, and it comes to the state with some requirements, such as the one that Dawn has just mentioned, but with most policies left to the state. And so through multiple processes in Oregon, the state comes up with a set of policies that get reported in the plan, and then we get held accountable. So for instance, a state can be held out of compliance, and it could be that simply the policies that we've adopted don't work. And so the problem isn't, this is really important in the subsidy program. We could be out of compliance because of something in the way we are paying providers or something, but it could be that the plan is the problem, that what we're actually doing is just fine. And the thing that I think most people get confused about is they think that the feds are telling the state. Most of the time, the state is telling the feds through the plan. Does that make sense? I mean, it's why it's so important, because once we say this is our plan, then, and it's, how many? It's a lot of money. Dawn, how much is it?
It's about 138 million.
A year?
Biennium.
A biennium.
Yep.
And it's going to go up.
Yeah, and that's not counting the some new discretionary dollars that we're anticipating. So, but it has consistently gone up when you kind of look at the trend.
Right. And so why the plan is so important is because it's what we're going to be held accountable for. And if we don't think that's what we should be held accountable for, it's probably our own policies for most of them, because it's really not that much built in from the feds.
Yeah.
Okay, that's my interpretation of the CCDF program. Dawn, does it sound right to you?
Yeah, it does. I mean, how I was thinking about it, and I think some of the I think it's 3 kind of policy discussions that I've kind of teed up for us to have is this what we want to say about our state or not? You know, is this the story that we want to tell? You know, or is there something that we would rather be able to say? And then that means we need a policy decision. It doesn't mean that we change the state plan as it needs to be submitted June 30, but are we going to want to amend, or are we going to be able to tell something else to the feds?
Great.
And so, so along that, this is kind of the calendar for our state plan. Is that we're doing this today in April. Look, we're on time. We're looking for an Early Learning Council presentation and discussion on March 18th. We're getting ready to do a 60-day posting of the draft for the plan for public comment. There'll be a formal hearing on May 15th. And then our plan is due June 30 to be submitted. A little bit after that point, then the feds review it. They always come back with questions, things for us to clarify. So we kind of have a back and forth opportunity with them until they do a final approval on our state plan. And so I wanted to kind of outline kind of the goal areas. Then I'm going to go just a little deeper, and kind of in 3 of the sections, we're going to kind of stop and have some of those policy discussions to kind of give you a flavor of what we have now and just some questions that might emerge through that discussion. So the first section of the state plan, and this is probably about as visionary as you can get in it, is a little bit about talking about the leadership and the coordination. The second section is, how do we promote family engagement and outreach and consumer education, provide stable childcare, financial assistance to families, ensure equal access to childcare, quality childcare. And then the last four is establish standards of monitoring, recruiting and retaining the workforce, supporting continuous quality improvement, and then ensuring grantee accountability. And again, I'll go into kind of a little more detail about what those mean, but those are the 8 areas that we need to respond to. And I will say we work really closely with DHS in the preparation of the state plan, as a lot of these sections are around the ERDC program for our state. So the leadership, defining the CCDF leadership. And so they want to know about decision-making and how we coordinate among partners and state systems. So we'll actually be talking about this in that section, this conversation that we're having, how the state plan, the development, the approval, the implementation, how it's administered. There's questions on that. I think one thing too that I should note is that this isn't a very narrative plan. There's a lot of check boxes. Do you have it? Don't you have it? Do you have it? And then you have like a space to write to kind of give it a little bit more. So it used to be, actually back when I started, a very narrative process, and they have definitely made it, and most likely so that they can actually do some comparison between the states about what states have and don't have. But I also think that format gives us somewhat of a nod to some things we might consider, as I think you'll actually see a little later on. We talk about our partnership with the Child Care Resource and Referral and other partners in looking at the accessibility and continuity of child care. And our statewide child care disaster plan is a part of that section. We then, the second section is really looking at that family engagement, outreach, consumer education. And so in this section, we need to provide the information of how we're providing information to parents, how are we telling parents about quality and best practices, what's our engagement with state policies in terms of emotional, behavioral, mental health, developmental screening. So we talk through what our state efforts are in those areas. And it's particularly because this is a new federal requirement, is our status on implementing the new requirements around the web-based consumer education, which I'm kind of shocked. It's come up 3 times now in this conversation. It's definitely been a significant, I think, change in Oregon of the information provided, and a lot of work is going in there as we incrementally increase that transparency. So the third section, and after this section, we actually will have a little discussion around some of the policies, is providing stable child care financial assistance to families. So this is really around the ERDC program and the eligibility requirements we have, our policies and procedures on kind of phasing out parent co-pays, documentation, verification. So it's kind of like all those policies and procedures that we have in the subsidy program, as well as how we're prioritizing for children furthest from opportunity, children with special needs, families from very low incomes, children and families experiencing homelessness, and that transition from TANF. And so one of the policy discussions that I thought would be good to have around this is, and this is a specific question that we actually do need to do a narrative on, is does the lead agency allow parents to qualify for CCDF assistance on the basis of education and training participation alone, so without the additional minimal work requirements? And so currently our state policy is that there must be a combination of work and education in order to qualify for the ERDC subsidy program. And so that's, I think, a good example of what Bobby shared, is that that's a state policy, not a federal requirement. So they want to know which we're doing, and we need to document. So the plan that will go in June 30 will actually state that it's a combination of work and education. Obviously, there'll be a few more words around it, but that's in essence what it will say. So I thought it would be interesting to have a conversation. I know at the council meeting, we heard some about this through the provider engagement session. And so I thought this might be a good way of, is this the story we want to tell in Oregon? Any thoughts or discussion that people have around it?
The question is if a parent is only going to school or is working a very small number of hours, should they be allowed to have their childcare subsidized for the hours of class and the hours, their homework and all the related?
This is Sue Norton. I really believe that we should allow them to get subsidy. You know, after working at a community college for many years, really for single moms or families that are farthest from, you know, having the ability to get a higher paying job, it's really the only way that they can actually, you know, work towards getting something that's going to be sustainable for their family.
This is Pam Hessler. I couldn't have said it any better. I totally agree. The path to economic upward mobility is education, so we need to support that.
This is Kamala Wymore, and I agree. Everyone said it perfectly, so yes, more of that.
Hi, this is Abby. Is there a minimum course load or training load that's required? Is there any guidance on that, or is that also something we get to set if we go on the education only, which I am very supportive of? Just curious if one class per term would qualify, or if we're, you know, you would need to be at least part-time or full-time.
Yeah, Abby, this is Dawn, and I think when I think about how how the eligibility works, is it's actually for like your work or class time. So kind of like in Oregon right now, you can bill for however many hours you're doing care. It would be kind of that same approach of how much time you are in school. Without going to the federal registry and looking up the specifics, I don't know exactly what those requirements are. I know that you can do it without any, but there's got to be some parameters about, you know, if it's full-time or part-time, what are those hours? So what is your time doing the training and education?
We've run, in the state, we've run some pilots of student child care assistants, and we could look at those also. And Urban Institute wrote a paper on CCDF policy, state CCDF policy, and we're an outlier in not allowing students to get child care assistance without the rather substantial work hours. So those are all state decisions, is my understanding. And we could say you have to be carrying 12 hours or 15 hours or whatever. We could say you could do a combination of work and employment if together they equaled whatever. I mean, there is a lot of, but they wouldn't get it. They wouldn't get it unless it was the equivalent of working full, you know.
Yeah. Yeah. And I think, you know, I pulled this one out because I think it was a good example, especially since we heard it at the council as well, about, you know, choices, which of course we know funding's an issue, and those are the hard decisions to make at a policy level of supporting. But it sounds like this might be a topic that we need to figure out how to have a conversation about, just given the comments that we've heard. And when Bobby and I were kind of prepping for this conversation, we felt like having this opportunity to go through it would actually pull out some possible policy areas that we do from the Early Learning Council that we would take forward of possible policies we want to address to move forward.
And the copay came up at the council also. Oregon has a very, I mean, we improved it in 2007. It used to be worse.
Yeah. Oh, yeah.
And then one of our studies showed that the worst part of our copay was that parents never know what it's going to be. And so it's very hard when you don't have very much money and you have to budget it, and your copay can jump by hundreds of dollars in 1 month. And so I don't know if we should have a discussion, but it feels like we should be stable. At the very least, we should be stabilizing copay. Anybody in the committee have experience with parents having their issues about their copay?
Yeah, this is Kamala. When I worked with KinderCare, we had parents all the time with challenges with copays, and to the point where they were disenrolling and then re-enrolling and losing coverage because their copays would be, you know, $25 1 month and then hundreds of dollars next month. And that's a lot for a family that's just getting by. I think it really should be a consistent copay every year, you know, minimum, that it just doesn't change all year long. I mean, it's just not fair that it goes up and down and they can't manage and forecast. It's crazy.
Okay, that one came up. And John, the other one that I heard a lot at the input from the providers, it's not an easy quick fix, but it's like the providers were having to spend way too much time trying to make the system work for the parents. I mean, in the bigger organizations, they'd have a staff member full-time who did nothing but kind of intervene on behalf of the parents. And for those small home-based providers who were at I don't know how they were doing it, because they were talking about being on the phone for hours with the subsidy program. I see heads nodding. So I think it's kind of trying to get out what are the policies that are leading to all this need to tinker all the time.
Yeah.
Okay.
I think this next section is really on the same with subsidy that you'll see is around, you know, what our approach and policies on parent choice and promoting the healthy child development. It's about the payment rates, the payment practices, and the market price survey, the strategies, employment to increase the supply and improve quality, particularly to children traditionally underserved. And so this is just kind of one section that I felt kind of it kind of leads to that supply. And this is, again, pretty verbatim from the plan, is how does the lead agency develop and implement strategies to increase the supply of and to improve the quality of child care services for children in underserved areas? And so these are actually the check boxes that I talked about. And then I kind of put what we would be checking, and then kind of the wording that would go behind it about what we have. And so with grants and contracts, which are an option in CCDF, you know, outside of the voucher program that we have in ERDC, we have grants and we have contracts with some Head Start programs for that wraparound care. And for those of you who might remember Oregon Programs of Quality, I think we have, Bobby and I think we have, as we were talking, a few older contracts for child care providers, but it's very small and limited. There's a specific ask about family child care networks, which we're able to mark, and we talk about the hub funding that goes to there, but that also notes, I guess we probably don't put this in the plan. It's also very limited funding once Race to the Top dollars went away. For startup funds, we don't have anything, so we would not be marking that box. Technical assistance support, we would be talking about our licensing system and our CCR&R partners. The recruitment of providers, I think we put together, we'll be talking about each agency and some of the strategies that are used. But each agency there's not like a collective strategy. We did in, what session was it? I guess it was 14 or 13, did the tiered payment, so tiered reimbursement. So for programs that are a 3, 4, or 5 star, there's different levels of additional dollars you get in your subsidy payment, as well as there's an incentive for parents. They have a reduced copay in order for, if they choose a star-rated program. And then the other, check that they put in terms of increasing the supply is support on business practices. And then we would talk about a few cohorts, which I would say are smaller in size. They're very intensive and good. They're very good, but there's a small impact on the number of providers that have access to it, as well as in the CCR&Rs provide various trainings to help child care providers with their business practices. So, part of what I was thinking is it'd be interesting to get your thoughts on, these are the things that we will be able to share in the state plan that's due June 30. But like in the future, what would we want to maybe have this look like? What are some things that stand out that we may want to move forward, have Bobby move forward to the council of places to consider strengthening?
Do any committee members have experience with any of these items that are in this list?
Well, this is Sue Norton. I mean, I certainly have a lot of experience in the CCR&R with the technical assistance support. And also the family child care networks. Recruitment of providers. As a center, we got tiered payment. So quite a few.
Sue, this is Dawn. In your from that experience, like what were some other things you would have wanted to be able to do here that you would wish we could talk about, but we just haven't done it yet?
Well, I think in the TA support, we've been having conversations in our CCR&R about how to get the capacity to do the coaching and mentoring, which really, research shows that to really change behaviors of that caregiver, you really need that ongoing coaching and mentoring. But it's, it's difficult in our current capacity to really put a lot of, folks out there in the field to do that. It certainly, we can see it work too with the family child care networks, and our CCR&R has had those for many years and really sees the benefit of having, networks that we can have a staff person actually do coaching and mentoring for that group of providers. It would be great to have many more of those because they really connect those providers with the community, and we can really provide a lot of technical assistance to increase the quality.
Yeah, this is Kamala Wymore. I had a lot of experience partnering with Head Start and the grants and contract portion. We have lots of successful partnerships in lower income areas that had families that really had a high need of subsidized childcare, and I've seen lots of great partnerships with that, and I think that those grants should be expanded and focus on how can they really get them out into more areas, because they were limited often to specific counties. And I would know a school that may have a need, but they didn't have the funds in that specific county. So it'd be nice to see an expansion of that.
This is Pam. Sue, you were talking about TA support, and you also mentioned that you had community college background. And I'm not sure if this is way off base, but do you have any models that engage the community college in providing that kind of TA support?
Well, our community college is doing a pilot program where they're working with some centers in town that want to do their practicum at their site. So those folks will take community college courses, but they're working, so, and they can't come to the college to do the practicum piece. So we're, experimenting with having them do a term of their practicum at their work site. And so it, that just in general provides a lot of technical assistance to the individual person, but also it filters out into the whole center that they're working in. That's the model we've used. I think Umpqua Community College also does do practicum at the work site. And then they have a faculty person that goes out and does the supervision and the assessment piece of it. So it's really helping those providers that have to work, and then they can get TAA assistance right there at their place of work.
I don't know, Dawn, where this comes up, or if it even fits into the plan. It's a professional development issue. But but Pam, you brought up community college. At one point, I think we had ECE programs in, I don't know, 15 or 16 of the community colleges. And we're now down to, does anybody know, but it's way down. And we've lost the programs. It's a catch-22. Most of the boards, college boards that eliminate it on the basis that even with the degree, they're not going to earn a living wage. And so they can't justify using community college resources to invest in a career that does not provide the student a family living wage. Does anybody know what we're down to? And anyway, I don't know that it's a CCDF thing, but boy, is it a huge issue in Oregon.
I think Clatsop, Tillamook Bay, Oregon Coast, and I think there's one more that have dropped their programs.
Thanks, Abby.
Mm-hmm.
Bobby, I do have actually a professional development one that does touch on post-secondary education in one of these sections. So we'll actually touch on that a little bit.
So we'll drop it and come back. Okay.
Yeah.
This is Tim. I just wanted to comment about startup funds. I mean, I guess this is dreaming into the future, but wouldn't it be amazing if Oregon foundations had a pathway, an easy pathway to start up nonprofit child care centers? Whether it's facility cost and capital campaigns, or just, kind of an on-ramp for people who want to start nonprofit child care centers. It should be easy.
Thanks, Tim. It's noted.
Yeah, that was Tim. When I was writing this, I was like, oh, I hate to put none, but we just don't, we don't have any. And, the other thing I was thinking, and I guess I felt it was important to put limited funding, and I think it goes to Sue, is wouldn't it be amazing if every family child care provider had an option to be in a family child care network? So it's like I think we're doing a lot of great things. It's just the amount of which we can do because of limited resources is where, you know, the challenge always is. And I know we know that. It just sometimes when you're writing it, you're kind of like, well, we have it, but we have a few, you know, and it would be in the future, like I would love to be able to say we have 50 family child care networks out there serving different targeted populations.
And they're stable, and the funding is stable.
Yeah.
That's what I want
to. Okay, are we ready to move on to kind of the next section? Okay. So this next one is establishing standards and monitoring process to ensure the health and safety. And so this is where we talk about kind of the licensing requirements. Inspections for the providers, accepting subsidy payment, training for our licensing specialists, the requirements for pre-service training and ongoing provider training, as well as the comprehensive background check. So that's if you know, kind of look at those topics, that really is kind of the licensing system, and this is where we talk about it. And one of the policy discussions, and there's actually 2 slides on this, about what we put into this section, and a lot of this has been driven by the new reauthorization, about what the initial training requirements are. In the state plan, they talk about pre-service requirements as being within 90 days. So not like how I would think of pre-service, but it's more this 90-day orientation period is how they talk about it in the state plan, that you need to have these things. And so in Oregon, what it looks like is for our regulated subsidy non-relative care. So if you're a grandma, you don't, you know, these things are not all required of you. But there's the DHS orientation, first aid and CPR needs to be taken. The new, boy, acronyms are bad on this, I apologize, but there was a lot of words otherwise. The new child care health, introduction to child care health and safety training, that was a new federal requirement, as well as the recognizing and reporting child abuse and neglect, which is RCAN. And so you can see how that's fairly consistent across the different types of care, with RF being the registered family, CF being our certified family. And within the certified centers, this is really just a staff requirement of the teacher, is to have the recognizing and reporting child abuse and neglect, the first aid CPR, to do an orientation as a new employee in a center, and then the food handlers. And I think it's important to note the food handlers is only if you are going to be touching food and serving food. What we're seeing in the new rules, which is a part of, it's a part of our introduction to child care health and safety, but there will actually be a new requirement that if you work with infants, that you take a safe sleep training, is in our proposed rules. And so those are, and these all fall within what we need to have federally. And so that's kind of those training requirements that you need to have within that 90-day period of time. That's what the feds say. In Oregon, I think we have a few little nuances to that. But the other part that when we think about pre-service training requirements is in caring for our children, it recommends 30 hours of pre-service training. So it's a difference between the pre-service of those basic health and safety and then 30 hours of pre-service training, which we could think about it as pre for the ongoing training requirements that we have. And in our current rules, we don't have that. And so I think that's important. Sometimes when we think pre-service, yeah, it's the pre-service of these initial training requirements, and those meet within that, the orientation and pre-service that's required. But there is also a best practice out there of looking at how do we have people have some child development and have some training prior to working with children. And so I just kind of wanted to point that out so that people knew there were those differences.
So I think, Dawn, that conversation I've heard forever is like, to be a CNA, you have to take a week of training, I think it's 30 or 40 hours. And before you can be a certified nurse assistant in a nursing home or something. And the question is, if you can't work with the elderly without 30 hours of training, why can you work with young children without 30 hours of training? I think that's the question. Have other people been in conversations about this issue? Do you have opinions on it? Other than that, that all hell would break loose if we did it. But apart from that,
This is Pam. I'll just go out there and say it makes sense to me. I get that it's complicated, but it makes sense.
I mean, it's also a low-wage job, but so I'm not quite sure why it's so strongly rejected in early learning, but not in elder care.
Well, the difference, though, is that if you are a CNA, you can then work towards the next credential and the next credential. So it is a career pathway. Mm-hmm. And it's hard to make that argument with childcare as much.
Yeah, this is Kamala. I agree. I mean, I think it's great. I would love if that was the reality, but because early childhood isn't necessarily a strong career path for a lot of people, there's a small pool of talent out there, and so that's the challenge that I see trying to implement something that rigid up front.
And what the workforce study shows is that we have AIDS assistants, and even to a certain extent, center teachers are coming in and out all the time. They're not a stable, whereas head teachers, directors, providers, way over half of them have been in the workforce 5 years or more. It's really low, as low as like in the teens, I think, for AIDS. I shouldn't ever quote without having something in front of me, but very low. So it would be really problematic that somebody's not even made a commitment to stay in this for more than a year or two, to ask them to do 30 hours. But I think it should be on the screen. How about if I share that we discussed it, and that what I heard is it makes sense, but when it's outside of a career pathway, it's problematic, and given the conditions under which people work, it's problematic. How about if I share that with the council? Because it would take systemic change to make it make sense. You couldn't just drop it in.
No.
Okay.
And so then the next section is about recruiting and retaining a qualified and effective childcare workforce. And here's where we look at the kind of the professional development system, the training requirements, requirements for all providers caring for children, the accessibility, the types of providers. And kind of one of the questions, and this gets to kind of what started to occur in our previous conversation, is this is again is one section where there's a lot of check boxes around what the professional development framework and how it connects to post-secondary education. And so it asks, what are we doing in these areas? And you can see on the screen that there's some we have none. And so so like in our Oregon registry, the continuing education units are credit bearing. So how do we connect our training to credits? is that a step 7 on the Oregon registry does translate to some credits within the community college system. And we do have some CCRNRs that are able to work with their local community college, or if they're in a community college, do some linking. But I think when you look at the broader workforce, as we're moving forward, I think some states have more direct connection than others. Financial assistance to attain credit. We have scholarships. We have a long support from the Oregon Community Foundation through the Betty Gray Scholarship Program that provides scholarships to programs. And I think that's an interesting note, is that even though CCDF isn't paying for those scholarships, we do talk about them in the plan because it's having this system, it's leveraging all of it. So the CCDF plan is not necessarily a budget document. I mean, it is in the sense of we identify where the funds are going, but we also just talk about the other work that may not be directly funded by CCDF. Financial incentives linked to education attainment. So the education awards that are given out when a early learning workforce member receives a certain step on the registry in terms of a kind of a recognition, a monetary recognition of that. Financial incentives and compensation improvements. We don't have that in Oregon about really looking at the compensation issues. As well as apprenticeship programs. I think there's some probably pretty ad hoc work done in terms of outreach to high school. I'm not sure how much intentionality. I mean, I think it's just very much based on the community. And we don't have policies for paid sick leave, annual leave, health care, or retirement for providers for the workforce. And we don't do anything to support providers' mental health. So, when I look at, as I was thinking through kind of what we would mark, there's some, obviously good stuff we're doing, but there's definitely kind of can give us maybe some ideas of other work that maybe we can do to really add to our professional development framework. Any thoughts on this in terms of kind of what we were starting to have our conversation on? Again, the hard part, I think, of these conversations is what it takes is a real investment and dollars to be able to do more.
Yeah, I think anytime you can incentivize people, especially when they're struggling through their beginning career and trying to move forward, that's great. I really like the idea of apprenticeship program. That would be really interesting. Maybe could help fill a true need and a true gap if there was some deep leadership and something really organized and planned around that did support and champion and partner with high schools and create some sort of path, college career path or early credits or something where they could get involved in child care centers. I think that would be something really to think about.
Great idea.
Yeah, I'm really interested in the apprenticeship program too. I think it could be a way where people could work and then also, so they could earn a living wage and then engage community colleges to do some kind of collaboration around credits and coursework. And I think it could work really well. I think one of the other things that we do at least at our CCRNR, and I think the other ones at our community college, is that we do provide a fair amount of technical assistance on how to connect into secondary education. We have a program here called PASS where they're doing work with ABSE students and ESL, where they're taking their ESL courses plus their early childhood education courses. So they're helping feed them through the pathway certificates. So we do a fair amount of technical assistance on that with getting providers in. And I think a lot of R&Rs are doing some of that work.
Yeah. And
Dawn,
I'm
this
just
is
kind of looking.
Abby. Can
Yeah.
we just go back a second? I think we're going to continue to have these conversations until we can address the compensation issue, and that's marked as a none right now. So if anything that we can do in that direction I think would only help the workforce and professional development efforts.
Abby, I was thinking the same thing. It's like a catch-22.
Yeah. And I feel like a broken record, but it's a big elephant in the room, I think.
Is there anything being done kind of on the healthcare and retirement? Like, are there examples in other states where there's subsidies to, so it's not directly affecting compensation, but it's helping with some of those other costs that people have?
I think that Alabama did a tax credit, or I just learned about it this morning, where they did something that was a tax credit investment for providers that boosted their compensation levels in some way. But it's on my list to search out more information about that. So I can share it when I find it.
That'd be great, Abby.
Also,
that's intriguing.
If people haven't seen, the National Academy of Sciences has a new publication. Maybe I'll send it to you, Chris, and we can send it out. A new publication on financing early care and education, and that includes paying family living wage to the people who do this work.
So the last two sections that we write about in the state plan is supporting continuous quality improvement. This is where we talk about what SPARK is, our quality rating and improvement system, activities specific around infant toddler child care, our CCR&R system, and our program standards effort. And so that's what we talk about in that section. And then this one is really ensuring grantee accountability. And you can imagine that this is a lot to do with DHS and the subsidy program around our accountability measures and policies to ensure integrity, from desk audits, case sampling, subrecipient monitoring, and DHS Office of Payment Accuracy. And I can share with you, they actually do also audits of our records for subrecipient monitoring. They look at our different cases and make sure that we have all our documentation around kind of not facility compliance, but just the facility licensing process. And so we write about what we're doing in those sections and how we're addressing what the requirements are. And so I know that this is a very large document with a lot more questions than I was able to share with you, but I hope it gave you kind of a sense of what we need to answer and to understand that it's not a visionary plan, but it is an opportunity. When I read through it, I'm kind of like, oh, I wish I could write this here. I wish we had that. And so I think it helps, part of I would assume the goals is to kind of have, keep states pointing a nod towards, adding additional supports and strategies, as well as learning to help share with other states. So that is CCDF, the state plan that we're working on.
So I think, Don, I don't know when this is going to be on the council agenda, but maybe I'll work with Chris and we can pull together and hopefully share it with you before we take it to council. And I'll pull out from Chris's notes kind of feedback. I think feedback on the plan, things that this committee says the council that are highly relevant for the council to consider in relationship to the plan. How's that? That's where we'll go.
I think that's good. Yeah. And I think, Bobby, one of the things and I think we can talk about, and at another time, because I know we've got 2 minutes and I know I've got another meeting right at 3, is, you know, as we write this plan and review it of what we have, it might be interesting to go then through it and say, are there some other policy discussions that we think we need to have in our state?
Great idea. Yes, because it's easy to amend the plan. So that's another thing is we don't have to wait 2 or 3 years. The state can be updating it all the time. Okay, we will meet in May on the second Thursday, and I know we'll continue working on strategic plan, and I'm not sure what else is going to be on our agenda, but for sure strategic plan, and hopefully moving forward on this, helping the council hear from parents. So thank you, everybody.
Hi, everybody.
Bye.